Thank you very much, Tim. Yes, and good morning or good afternoon, wherever you are. Our company is a very straightforward company in the types of services that we offer. And I'm not going to go through the individual applications that are there, but our ethos is that we want to serve the GP or the healthcare professional in communicating and having information shared with their patients in an online or in the cloud solution that is as easy as possible for them to use. Professionals, like doctors, like anyone else these days, very time constrained, and we look to service them in that way. Jayex as a company has a long lineage here in the UK. It's been going since the late 70s, and for anyone who's travelled over here, you'll be aware that there's the D900, which is the original red LED board that used to flash your name up to tell you to go through to your doctor's treatment room. Now, that lineage has led us to have a large number of locations here. And what we're doing now, and what I'll show you through this deck, is how we're expanding the technology that we provide to doctors to that very large base of customers that we have. So moving on to the next slide. We do operate in Australia and New Zealand, which is where we did the IPO back in 2015. We have a significant lineage here in the UK. And one of the important stats is that we see or we interact with about 50 million patients per year. And that means that we have a lot of touch points to work with patients in terms of leading them into additional services. And that is something that we are focused on now. And I'll go into that in more detail. One of the exciting things that we've done over the last couple of years is move from an on-premise offer, and the on-premise offer is located in the clinic or in the hospital, to in the cloud. And in doing so, we've moved from a traditional box mover type model to a SaaS model. And that is having an impact of increasing margins, as well as increasing the saleability of the products from our point of view. Next, please. So in terms of what we do at its very basic core, we started out, we're calling patients, we're queue busting, we're providing efficiency between the patient and the doctor. Very importantly, these days, we're also involved in social distancing, because what we can do is we can use the telephone, the mobile phone rather, we can use tablets, we can use display and calling, and we can actually keep people socially distanced throughout their hospital or GP experience. We also enable more information to be collected. So without burdening frontline staff, we can do patient updates, we can do surveys, we can do things that enhance what the patient can provide to their doctor, and hence over time increase their healthcare outcome. And most importantly, we are paperless. We integrate with virtually all the major systems, both in terms of hospitals, as well as importantly in GP clinics. Next slide, please. What's been important in the last couple of years is we've moved our on-premise Enlighten product into what we now call Jayex Connect. And Jayex Connect is very important because it strengthens the bond between the GP clinic and the patient, and it allows us to put more products down that pipeline where we already have customers and users. So if you recall the first slide, we had a number of core functionality abilities. We now are adding to those abilities at very low cost and increasing the amount of information that we share, and therefore we also can increase our revenue per customer. And we're looking to show that in the coming quarters as a revenue per customer based on per GP served. So last couple of years, convert to the cloud, and then move into new product distribution. Some of the new products we have developed ourselves. So for example, with COVID-19, we have taken our at the kiosk check-in, and we have taken that to be something you can now do on your mobile phone. Over here in the UK, we are able to actually keep the patients in their cars until such time as the doctor wants to see them. So that's a very new initiative. The other area that we're looking at is remote patient monitoring. And that can be very simple in terms of just monitoring movements around the house, trips to the bathroom, when you got out of bed, did you take your pills, through to high-end sort of if you think of it in terms of disease states, specific disease states, be they diabetes or they're post-operative sort of requirements coming out of hospital. And we're moving into that again to assist the GP and the patient to share information. The focus that we have is to move to SaaS, and as I said before, that is going well. And we would anticipate over the coming couple of years to move about 80% of our customer base to that model. We will always have on-premise. Some of the hospitals, for example, have very deep employments of our products, and it'll be very difficult to move those in the short term. Next slide, please. We'll go straight through this one. I've spoken about SaaS and our move to that. This is the small innovation that we pushed out in the last few weeks. It's been very well received here in the UK. It effectively provides a socially distanced experience for the patient, and it requires no download on their behalf. It runs automatically from the practice once they're within the desired location, and of course it is extremely quick and seamless. And as far as the clinic goes, the patient is in a safe location, able to be called in quickly, and everyone maintains that social distancing which is required. Next, please. We recently announced a license deal with Lifespot, another Australian company involved in monitoring devices, and we are poised to roll out the first of one of their products, which is FeverTel, over here in the UK. We are exclusive on that in the UK, and we're looking forward to the next couple of weeks to move it out to not just our NHS clients, but also to corporates such as banks, insurance companies, security firms, as well as non-government departments like education, for example. It's a great product, and we'll see how that goes. It simply involves a platform to control and measure the temperatures of your employees, but at the same time it builds a data set around how that tracks through the employee population, so you can monitor and manage them, whether they be in one location or many. Again, important here is that we are working between the GP and the patient in order to enhance the information set that the GP ultimately gets. Next, please. This one is a very simple slide. Blue is where we currently are. Green is where we want to move to in a general sense. And then probably added to that slide would be the remote patient monitoring, which again sits with primary care, but in some cases can be across in social care or community care. And that's a slightly different marketplace, but we are seeing demand for that, particularly now that a lot of medical programs and protocols are being reevaluated around social distancing practices. Next, please. Some of the partners that we work with, Cerner, it's a global EHR system. We are their preferred partner worldwide for kiosks and arrival solutions. We recently completed our first Cerner New South Wales project, which is now going live up in New South Wales. The others, InterSystems as well, they're an EHR operator. The rest are practice management systems, or PMSs. Best Practice and Medical Director, the two leading Australian ones, and then the rest across here in the UK. And probably the next slide, I think. From our 4C at June, we run on a calendar year. So that was our half year. We're cash flow positive, which is good. That's a first for us. So we're moving into new territory. As we move further into SaaS, we would anticipate that that would continue. Traditionally, September is a quiet quarter for us. If you think about budgets and government departments, the NHS cycle finishes in March. So traditionally, the first quarter, March, and the second quarter ending in June are very strong for us. We will see a drop in September, but then we would like to think that we, with SaaS, will be picking that up and maintaining cash flow positive going forward. Next slide, please. That's where we sit at the moment. You know, we haven't raised any money in the company since we floated. We have been obviously higher when you go through and look at the history of it, where we've now brought the company back to a position where both the capital structure, the operational structure with the staff, as well as our products have all been refined and sharpened so that we can go out and now start growing the business again. Next slide, please. Really a summary of some of the things that we're looking at in detail. You know, our core ethos has not changed. We don't see ourselves as being a medical expert. We want to enhance the GPs and the hospitals that we work for in terms of their capabilities. There is plenty of room for that, and you know, we look forward to working with them to bring more products to the market over the coming months and years. And I think that is it.
Thanks, Michael. We've got time for a couple more questions, if you don't mind. So the SaaS model or subscription model, I assume, is the hospitals pay based on the number of patients. Is that how that works?
The way that we work, we provide a platform where all of our services can be put in. So, for example, we might have a clinic that has our arrival solution, but is not running display or campaigns. What we've done is, rather than have those as standalone to be installed modules, they are live on the customer's screen, so they can at any point look at them, play with them, and then subscribe to them. And you know, what we are obviously then doing is marketing to those patients, to the GPs, the benefits of using all of the system rather than just part of the system. And that's quite a change in previously, where we had to physically deliver a kiosk and physically install it and wire it and do those things, which obviously was time and money and took away from margin on product.
And there's a couple of questions here on what's your competitive advantage? Who are the competitors in this space?
Yeah, look, there's two distinct markets. So in Australia, we are probably we're not the biggest operator in Australia. We have about 300 odd sites that we look at. They're predominantly GPs. We have now 5 hospitals in Australia. So we started with none back in 2015. Hospitals are a slower, longer lead cycle. Having said that, our book at the moment is very full in Australia for hospitals. In the UK, the market is a lot more mature. We've got some 3,500 sites, some 4,500 display screens. And the display screens are interesting in the fact that, we haven't really fine-tuned the revenue model on how that will work. We're currently, looking at that. We have over 45 hospitals here in the UK. And again, it's a mature market. The process here is trying to make the products cheaper, more accessible, and therefore grow the amount of product that we can sell to each individual customer. So we, for example, would rather the customers have our display and arrival solutions, not just our display and have our competitors' arrival solution.
I see. And so COVID obviously presents an opportunity, but does something like telehealth and that sort of engagement affect your revenue model?
Yeah, well, we haven't gone into telehealth. It was swarmed upon by everyone from the practice management software providers to here in the UK, the NHS did a blanket deal with Microsoft to roll out Teams. So we didn't really see a consultation telehealth. We've focused instead on telehealth that involves monitoring and the ability to share that information back to the GP or a healthcare provider. That is a market that is actually growing significantly, and it's growing not just because of COVID, it's also growing because the technologies are there, as well as the cheapness and the continuity of that care ability is becoming better and better every day. So if I was going to tell you what we're focusing on, particularly over here with 65 odd million people, we're focusing on remote patient monitoring, and we're going to grow it organically as well as acquisitions. So that would be the space to watch.
So that remote patient monitoring is the same SaaS-like model that's kind of.
It is. Typically it's an installation, again, a very low cost. So either products delivered to the house, and it's a monthly transactional fee. It's very straightforward.